So my role is to look at information and intelligence from the population. So we gather lots of data routinely, and sometimes through questionnaires, and sometimes from going out and talking to people. And my job is about bringing that together and trying to understand what people are experiencing and what they need and how that impacts their health and well-being. So my job particularly focuses on children and young people. So I look at data around children and young people's health, sometimes looking at maternal health as well. So when people are pregnant, what can influence the health of the baby and the health of the parents. It's also about implementing different policies, whether or not they're local ones or national ones, and also working with lots of different partners and agencies to see what we can do together to improve health. I really love the variety. There's so much to understand and get involved with, and I think particularly my portfolio area, which is children, young people's public health and maternity, I've got loads of different developmental stages, lots of different things to think about, and it touches all the different areas of public health, because we might want to think about food, and we are thinking about food a lot at the moment, and nutrition, tobacco, physical activity, mental health and well-being, development in utero, kind of you name it, and it's in my portfolio. And I really like that because I like variety and I like complexity and I like unpicking things and trying to understand what's going on. But I also really enjoy meeting people in communities and collaborating with different groups to try and understand what's going to help to improve things for them. And that's one of the reasons I wanted to work in local authority public health, because from a public health perspective, it's really applying the science and the evidence to a real world situation, and then hopefully seeing some real benefit in real life. If you enjoy science, if you enjoy learning continuously, if you enjoy your job changing day to day and variety, then public health is a great option. There are a few different ways of going into public health. We now have public health apprenticeships in our directorate, so that's a way of getting into public health, becoming a public health practitioner, and then growing and developing through that. A master's is kind of a foundational thing in public health. Within the apprenticeship and the training, that sort of does happen as well as people go along. I'd say do some reading, Google health inequalities, look at some of the big papers, and think a bit about food, look at different health policies, look at health outcomes data, and just see how the health of the population's changed, and see what you think about it.